My name is Amit, and I'm a psychiatrist based in England. And I recently wrote an article for a website where I shared my experience of my struggle with COVID-19. And that article generated a lot of questions. Quite a few people asked me a little bit more detail about how I got it or which medications I used and how the entire experience was. So I thought I would rather make a video log and perhaps try to share that experience with all of you. To be honest, I don't even know how I got it because the only two places that I used to go out were a supermarket and the hospital where I work. When I was going to the supermarket, I was using a mask. I had gloves with me all the time, and I had a bottle of sanitizer in my pocket. So the chances of getting infected from the supermarket were quite low. The other place where I was going was the hospital, the team where I worked. There were quite a few people who got ill. So the high probability is that I contracted the virus at my hospital. I'm not even sure if the day that I assume that I got infected is actually day one, because I did not feel anything on day one, day two, day three. I was absolutely fine. In fact, on day 2 and 3, I was working quite intensively in the garden. It was a nice and sunny weekend, and I did feel a little bit tired. But I assume that it's because of the sun and because of working so much after a long time that I might be having this tiredness. Day 4, in fact, I went to the hospital, but it was on day 4 in the afternoon that I felt this fever setting in. I had a temperature of 38 degrees centigrade. And when I came back home, I started isolating myself. In the next 2 days, I lost my sense of smell, and then I also lost the sense of taste, which was a very weird thing. The way I found out about my smell was that the bottle of hand sanitizer that I always had with me, I tried to use it, and normally it would smell of a very strong and pungent alcohol. But on this occasion, I was not feeling anything. I got a bit worried. I went to the dresser, I tried to smell some aftershaves, and I couldn't feel anything. So I assumed that yes, it could be a sign of the coronavirus itself. I was obviously developing this upper back pain. I was having fever. I was just taking paracetamol for that. On day 6, I lost my sense of taste. It was very interesting to know that when you lose your sense of taste, how empty your life becomes, because you can't enjoy even the minimal food that you eat. Day 7 and 8 were quite scary because my result came positive. I had a sense of relief, but at the same time I was quite worried because reading all that medical literature in the isolated room, I had the idea that how day 8 to 12 could be, because they are considered the danger zones of the illness. So I was keeping my fingers crossed, and day 9, I have no idea how it was because I was taking the painkillers. I mean, I was sleeping most of the time. It still is such a blur after 1 month. Day 11, I felt a bit better. I was able to move a little bit more freely in my room. But I developed this very dry cough, and the cough was so bad that it felt as if my lungs will come out of my mouth. So I tried to just rest a little bit more, and my temperature was still high on day 12, and then I started to recover. Unfortunately, on day 13 or 14, my wife developed some early symptoms, and she started isolating herself. I recovered completely within 13 to 14 days, and on the 15th day, I went back to work. I didn't specifically use any medications as such apart from symptomatic relief. So if I was having pain, I was using paracetamol, which I could also use for temperature. I Sometimes the pain was quite bad that I actually had to use a combination of codeine with paracetamol. But apart from that, I didn't use anything. Just in the start of the illness, I used some antihistamines because I thought I could be having hay fever. So I would say it's quite a mixed one, but more predominantly it was a scary experience. It's now been 1 month, but if I reflect on those 15 days, I remember preparing, of preparing situations of worst case scenarios, and worrying about life insurances, and feeling guilty thinking about the past things that I've done, and then also reflecting on what could I have done in this life in a way. When I was told that I was positive with coronavirus, I remember clearly that part of me was quite happy, but at the same time, part of me was very worried and very sad because I was in a way prepared for the worst case scenario. Luckily, unfortunately, I just had mild symptoms, and I did not need any hospital admission, and I stayed home and I recovered well. So, as a doctor, I would say that COVID-19 is a new illness, and there's a lot of research going on to identify and to learn a little bit more about this virus. But in the meantime, safety is the best uh, weapon that we have to defeat it. I think it's important to socially distance from each other, to follow the local healthcare authority guidelines, and also to use mask as much as possible. Interestingly, I just want to mention that I've seen quite a few people wearing masks in very absurd ways. That they just cover their mouth and they do not cover the nose. I mean, it's funny because it's like wearing undergarments without covering your private areas. So that does sound silly. So if you are wearing mask, wear it properly, and stay safe and stay healthy. Thank you. If you would like to know more about my experience, or if you have any questions, please drop a comment. I will try to answer them. And in the meantime, stay safe and wear your mask properly. Thank you.